the retina and the light receptors are very highly metabolic. They're churning over all the time. As part of dealing with light, they have to recover, and that's why we get that bleaching. You get a flash of light. That's all the light receptors being kind of bleached out, and then they need to recover. And as part of all our tissue not recovering as quickly, one of the risks is that your retinal tissue at the macula doesn't recover as quickly as well. And if you're not getting good recovery of the cells at the back of the eye, then that impacts on your ability to see clearly. And you start to get other issues with, not enough oxygen, and you get not enough oxygen, then you start to get new vessels growing, and new vessels leak, and they create problems. And so, yes, it can be quite a debilitating thing. One of the biggest reversible risk factors they talk about with macular degeneration is smoking. And so, being a non-smoker is really important, and you can actually sort of, the earlier you quit, the better. There does seem to be some sort of history involved as well. And again, with the advancements of technology, is that they've got the ability to try and slow down the loss of sight now through techniques with ophthalmology, which is very different to when I was going through university. There was nothing you could do about macular degeneration. It was all about trying to use magnification and various optical devices to try and get some quality of life back. Whereas now there's, if you talk to ophthalmologists, probably their two biggest things that they're busy with is cataracts and injections for macular degeneration, medical retina type work. Yeah.
And like the way macular degeneration manifests itself, the symptom is that you sort of lose that central part of your vision, isn't it? Or it becomes sort of grayed over and
or distorted,
less distorted. Yeah.
Yeah. So sometimes some people will see it as a patch in their vision, and they report having to look off to the side to sort of see things, or they may get some sort of misshapen parts of their vision, typically in the center.
There's something called, I think it's called an Amsler test, isn't it? Where you can look at like a grid of lines, and if the grid doesn't look perfect, if it looks a bit distorted, that's kind of a way you can sort of self-diagnose to an extent that you might have early signs of macular degeneration.
Yeah, and look, if someone has early signs, or they're concerned about it, then yes, you look at an Amsler grid. The trick is you look at a little spot with your correction on. So and usually if you need reading glasses and you're holding it at the reading distance, it's lots of little lines. You're looking at the central dot, trying to use your peripheral vision just to pay attention to any loss of lines or any distortions in those lines.
Okay, so that's macular degeneration. Whereas I think another kind of eye condition, which is relatively common, is glaucoma, isn't it? So that's where you lose maybe more of the peripheral vision. So what is glaucoma, and what causes that?
Yeah, look, it's considered to be, you might consider it to be a posterior eye condition because that's where we see the changes, but it's probably a whole of eye issue because we're dealing with the pressure of the eyeball itself. And if we think of the back of the eye as a bowl, we have the nerve fibers running across the surface of this bowl, and then they collate together to become the optic nerve and leaving the eye. And so the pressure is controlled around the ciliary body. Okay, so we have and the anterior chamber, and if the pressure goes up, then it puts pressure on those nerves and causes nerve damage. And if you get nerve damage, then you start to lose your peripheral vision first. And they often call glaucoma the sneak thief. So even though we talk about pressure, we don't necessarily feel the pressure because it's a slow creep over time. And if you become conscious of, because we don't detect blur in our peripheral vision, if you start to become conscious that you're not noticing things and people start to surprise you at shops and things like that, you just feel like you're missing more, then a good lot of the damage is done. So that's why there's a strong recommendation from optometry organisations that, once you get into your 40s, because that's when the risk factor for developing glaucoma starts to increase. Getting your eyes tested every couple of years, a routine vision exam includes looking at your eye pressure, looking at your optic nerve. And now with things like, you can see the Revo machine here, that's my OCT. We use that to actually measure the thickness of the nerve fiber, compare you to what we expect for your age and demographic. And then if we are suspicious that something's changed, then we can kind of compare any changes in nerve fiber thickness over time, coupled with doing visual field tests and pressure measurements and things like that.
And we've talked quite a lot on other interviews about myopia and how that is something that develops, in your early years, where the eyeball becomes more elongated. That phenomena, I think you call it axial elongation. So how does that lead to a higher risk of these kinds of posterior eyeball issues later in life?
You effectively find that the retina does not kind of keep up with the eye growth, and so you're effectively stretching that retinal tissue and making it thinner, and you're weakening it. So it makes the tissue more prone to tears. In very, very high degrees of macular myopia, you have a higher risk of myopia, macular disease, and glaucoma as well, because you're changing the natural structure of the eyeball. And so these processes don't work as well as they did. But yeah, it's all down to stretching.